Hello? Yes, I'm Elsa's mom. What? She's fainted? When did this happen? How is she now? During the PE. Which hospital, Cikgu? Okay. I'm coming right now. Thank you, Cikgu. Thank you. Cherry! Come quick! What's wrong? You come with me? Elsa fainted during the class. The teacher just called and told me that she's in the hospital now.
What?
Yeah.
Let me go get my bag. Parkinson's there. I know you're worried, Mom. Relax, okay?
No, just not that. I'm wondering, what is anorexia is all about? Like, really? What exactly is that?
Relax, okay? I go to her room now and get her clothes.
Okay, thanks.
Mom! Come here, quick!
Yes, what?
This is the explanation, Mom. She's not been eating.
In today's image-obsessed culture, many of us worry about putting on some weight, or wish we looked different, or could fix something about ourselves. That's only human. But if a preoccupation with being thin has taken over your eating habits, your thoughts and your life, you may have the serious eating disorder, anorexia nervosa. Join us in the next half an hour as we talk about another mental health concern. I'm Charles Roberts, and this is Mind Matters. Anorexia nervosa is an illness that impacts women, men, adolescents, and children. It does not discriminate. It affects all ethnicity, culture, and socioeconomic group. It is also one of the deadliest mental illness with a high mortality rate. Elsa is a 15-year-old girl. She was a big-boned child. Her older sister was skinnier and fairer. At family events, her aunts and uncles would make comments that she has put on weight, which made her overly conscious about her body weight. Feelings of inadequacy, low self-esteem, anxiety, anger, or loneliness may contribute to the development of the disorder.
Scientists have recently identified a gene, all right, that can contribute to anorexia. I mean, this particular gene does not impact everyone who has anorexia. Don't get me wrong, but unfortunately, there is a gene that the tendency of you becoming anorexic is higher if you have this gene. So therefore, kind of sort of is hereditary lah, to a certain aspect. Yeah, and if what also will increase the possibility of anorexia is if there are mental health issues in their family. Kalau the family members who have mental health issues, there's a possibility of a person having anorexia slightly higher, so to speak. Okay? And what else contribute to it? If a person, of course, she or she doesn't feel good about her image, her body, or overweight, and start to diet left, right, and center, and this can lead to, control of food and so on and so forth. Yeah. So these are some of the risk factors. Yeah. And what doesn't help also is in the family members who criticize. In our society, we love to criticize about color and weight, and people don't understand the impact that they have on people around them, especially if they're family members. So a family who does not understand or realize how the impact is about talking about weight can impact the person as well. And then sometimes, as in this particular case, they compare with the sister who is, slim and so on and so forth. So these are some of the risk factors that can contribute to anorexia.
Elsa then started following fitness models on Instagram and started working out every day and watching what she ate. She cut white rice from her diet and only ate fruit and vegetables. Her family members started complimenting her as she lost weight. Young adolescence is the time whereby both peer influences and appearance being very important. So it's not hard to see how people this age could become very focused on how they are perceived online.
I'm going to use the word addicted to social media. Social media has no control. They don't care. They want to sell their products, they want to sell their food, they want to sell their clothes and all that sort of stuff. And more, the younger generation gets influenced, or this is how we should look like, This is how, I should be, and movies, Hollywood bodies. God help me. Not everyone can have Hollywood bodies, but you make it look so easy, so simple that this is what we should be. So it's influencing them, and individuals, I guess, are not be able to assess, what's real, so to speak, because, it's on TV. It has to be right, and social media, they don't have any rules. They don't care. So, and how are we going to stop watching it? How are we going to set rules or whatever for them to abide by? So does social media contribute to anorexia or eating disorder? I say, yeah, they do. And they're not taking responsibility of it as well.
Istimewa TV Okey, khas Tahun Baru Cina.
Kongsi ni.
Bila tak baru dan bersosial.
Baiklah sayang.
Kita akan sambut Tahun Baru Cina yang terbaik.
Selamat Tahun Baru Cina. Kongsi Facai daripada kami di TV Okey.
Trend OOTD atau Outfit of the Day para selebriti dan personality maya menjadi perhatian dan juga inspirasi buat wanita hari ini.
Saksikan rancangan majalah fashion bersama pengacara anda Adriana Adnan yang akan memfokuskan konsep makeover. Saksikan Idola Fashion 11.30 pagi. Semestinya hanya di TV Okey.
The exact cause of anorexia is not known, but research suggests that a combination of a certain personality traits, emotion, and thinking pattern, as well as biological and environmental factors, might be responsible. Elsa started to work out twice a day. She became secretive about her eating habits, telling her mother she already ate with her friends at school. Or she would ask to eat in her room because she had a lot of homework.
Anorexia is really bad, and a lot of people don't realize that. A lot of people think that depression, of course depression is bad, don't get me wrong, okay? Mortality rate of depression and anorexia is higher. The mortality rate of anorexia is higher. 6% of anyone diagnosed with anorexia dies. 6%, which is pretty high. And also, when we talk about anorexia, someone who is seriously, very serious or severe case of anorexia, it is a very difficult, what shall I say, illness to overcome. Very, very difficult. And a person who is, I guess, has a serious case of anorexia, you're talking about organ failure, a lot of organ failure, you know, because, again, they're malnourished. Yeah. I've dealt with a patient, not here, in Malaysia, literally looks like my grandmother who was 85 years old. And she was 35 years old, literally. And she doesn't realize that she's thin. She still thinks that she's overweight. And she starves herself. And unfortunately, this person is also my friend. She eventually passed away. She passed away from anorexia. And on her dying bed, she still thinks that she's overweight. So anorexia is dangerous.
It can be difficult to tell if someone you know or a friend has anorexia nervosa. Someone who has lost a lot of weight may have another type of health condition. However, there are particular signs that indicate that someone may have anorexia. The signs include fear of fatness or pursuit of thinness, preoccupation with body weight, may tell lies about eating or what they have eaten, give excuse about why they are not eating, pretend they have eaten earlier. Not being truthful about how much weight they have lost. Avoiding eating with other people, severe weight loss, difficulty sleeping and tiredness, feeling dizzy, stomach pains, constipation and bloating.
Someone who has anorexia, one of the symptoms is that this person is extremely concerned about her weight. Extremely concerned about her weight. She weighs herself 2, 3, 4 times a day. Okay, she's very concerned about what she eats, her food content. Of course, she's a calorie counter. Yeah, she's a calorie counter. She's very concerned about restaurants that she goes to as well. Okay, so these are some of the symptoms, and some of the symptoms also that her self-esteem is low. She doesn't feel good about herself. You know, her energy level is low, right? Because she's not nourished, she's malnourished. And possibly have problems, if it's a serious enough case, GI type problems, because, you know, again, like I said, not enough nourishment, not enough food and all that sort of stuff. And also possibility that you will see the discoloration of her teeth, and then maybe getting rotten and all that sort of stuff. These are some of the symptoms. And she doesn't like social activities. They tend to withdraw, they tend to prefer to stay home and so on and so forth.
Individuals with eating disorders very often also have another psychiatric condition. The most frequent comorbid psychiatric disorders are depression, anxiety, and substance abuse disorder.
Elsa, why do you keep exercising? Huh?
I'm okay, Mom.
Have you finished your food?
Yes.
Failure to recognize and treat comorbidities can have catastrophic repercussions.
Sometimes, while you're treating the anxiety and you're treating the depression, the anorexia is hidden because they tend to hide that. They tend to be more embarrassed or ashamed of that, and they tend to hide that. Now, which causes which? You know, that's a challenge. You know, anorexia causes the anxiety causes the anorexia, depression, and you know, it's a challenge. We can sit down, we can identify which causes which, and sometimes kind of sort of intertwine with each other. So usually we need to treat all the mental health issues with the individuals. Anorexia can start at home because of parents not understanding, shaming the kid about the weight and all that sort of stuff, setting high expectations to the person in school and all that sort of stuff. And sometimes this is a form of coping mechanism. Sometimes it's a form of control mechanism to have control of my life. I control my food. I don't take my food and all that sort of stuff. So there's so many issues that causes anorexia. So which comes first? It's different for each case. So definitely we have to deal with all the other mental health issues, depression, anxiety, and so on and so forth, as well as, of course, anorexia.
Although there are no laboratory tests to specifically diagnose anorexia nervosa, the doctor might use various diagnostic tests, including laboratory values, a blood test, to rule out physical illness as the cause of the weight loss, as well as to evaluate the severity of illness or the effects of the weight loss on the body's organ.
Okay, how do we diagnose a person with anorexia? One of the criteria is if the person's body weight is 15% below the ideal weight of that person's height and all that sort of stuff. If it's 15% below, that is one indicator that a person is anorexic. Of course, there are other aspects of it as we talk about in regard to the person being overly sensitive to her weight, extreme calorie count, yeah. And as we said earlier, probably GI disorders and so on, yeah, can be some of the indicators that this person has anorexia.
Sekarang ni Atuk on ke tak on?
On lah. Apa pula tak on?
Kalau Atuk dengan Nenek sama-sama, saya pun nak sama jugalah dengan Atuk. Tok nak Tok.
Lagi?
Kau pergi tak majlis cucu aku tu nanti?
Oi, mesti. Kami orang nak naik bas hopon hop.
Dalam Fahmi tu harapkan kita berdua nak uruskan majlis pun tu. Abang yang macam-macam.
Apa nak risau ni?
Awak mesej siapa?
Lah, Atuk je.
Tak ada habis lagi ke dengan atuk awak tu?
Sejak bila dia ada kawan selain daripada aku dekat KL? Hah? Atuk tertinggal dompet? Atuk!
Istimewa di TV Okey. Drama khas Tahun Baharu Cina. Selamat tinggal Tahun Baharu Cina. Selasa, 1 Februari, 10 malam.
Benci kawan tu.
Leong tidak suka menyambut Tahun Baru Cina. Dia juga tidak mahu pulang ke kampung untuk meraihkan sambutan tersebut. Namun, selepas terjadi beberapa peristiwa, beliau mahu tradisi sambutan itu diadakan semula. Selamat menyambut Tahun Baru Cina. Kongsi Bacai daripada kami di TV Okey.
Recovery from an eating disorder requires professional help. Chances of recovery are improved the sooner a person begins treatment. It can be frustrating to watch a loved one suffer and refuse to seek help. During Elsa's hospitalization, her family brought her to see a therapist. The therapist diagnosed her with anorexia. There's no quick cure for an eating disorder, but there are numbers of treatments available to treat anorexia. Your doctor may recommend a combination of talk therapy, prescription medications, and rehabilitation to treat the condition. The overall goal of treatment is to address the underlying cause of the condition, improve your relationship with food, modify any unhealthy behaviors.
So for an anorexic patient, obviously there's going to be one-on-one. We could use CBT, treatment, because we're talking about cognitively making them understand that this is a dysfunctional behavior and that they have control over it, and so on and so forth. There are other forms of course, therapy as well. And also, I think it's very important that the family is involved. So the family needs to understand what is the issue, what is the problem, and where they can help, because the patient would need support besides coming to see the therapist and so on. They would need support from the family, from the husband, and so on and so forth. And like I said earlier on, different individuals, we probably use different techniques and stuff, but face-to-face psychotherapy, CBT, family intervention, group therapy, and also possibly involve a nutritionist, to maybe educate the person on how the best, well, I suppose, nutrients and so on and so forth, and how to eat healthily for the whole family, not just the patient itself. So they should practice it at home as well. Binge eating, there are a lot of people who do binge eating, but they're not bulimic, or they're not anorexic or anything of that nature. So we have to educate the family as well on the right and best practices of healthy eating.
Cognitive behavioral therapy, or CBT, uses a combination of talk therapy and behavioral modification techniques. It may involve addressing past trauma, which could have caused a need for control or low self-esteem. CBT can also involve questioning your motivations for extreme weight loss. Your therapist will also help you develop practical, healthy ways to deal with your triggers. Family therapy may be recommended for adolescents and children. Your therapist or doctor may also recommend support groups.
Elsa, listen to me. I will always love you the same, okay? I would never love you any lesser. So, whatever happens, you always have my support. Remember that, okay?
If it's a serious case of anorexia, any case is serious, don't get me wrong, okay? We're talking about a serious case to a point where organ failure is happening to them and so on. Obviously, they need to be hospitalization, And then we talk about anorexia having anxiety, depression, and so on and so forth. So yeah, sure, there can be medications to help stabilize the individuals. Yes, of course there is, but again, like I said, each case is different.
It can be difficult for friends and family to approach someone they love with an eating disorder. They may not know what to say or worry about isolating the person. If you notice that someone you love is exhibiting signs of an eating disorder, speak up. Sometimes people with eating disorders are afraid or unable to ask for help, so you'll need to extend the olive branch.
Unconditional love, unconditional positive self-regard. Basically, we accept the person as how he is or how she is. We don't put any conditions on the love, on the acceptance of that person. And the positive regard is that also the part of positive self-regard is, when we accept the person in unconditional love, that individual would feel better about herself. In regards to her esteem, in regards to her confidence, and so on and so forth, which is very important, because there's too many situations where people are judging us and so on and so forth. So it's important for her to feel, or for him to feel good about himself or herself.
People with eating disorders often become lonely and isolated. But those who recover say the love and support from family and friends is vital in their recovery. It is important for those close to the person to receive their own support as they frequently feel helpless, confused, frustrated, and angry. Whilst family are not the cause of the eating disorder, they are crucial in the recovery.
Deciding to get help for anorexia is not an easy choice to make. It's not uncommon to feel like anorexia is part of your identity. You may think that anorexia has such powerful hold over you that you'll never be able to overcome it. But while change is hard, it is possible. Thank you for joining us today. I hope you found this topic useful and informative. I'm Charles Roberts, and this has been Mind Matters.